Hello, everyone coming in as we're starting to populate. I'm welcoming you. If you want to share where you're from, your name, your organization in the chat, that would be fantastic. And we're just going to give it a few minutes before we officially get started. Welcome. Okay, we do have people still continuing to filter in. And while they're doing that, please make sure to introduce yourself in the chat. I see some popping up there. So thank you all for joining us. I'm going to officially get started to be mindful of everyone's time. So here we go. Welcome. Today, our webinar is titled Dangers of Drug Impaired Driving. And we are sponsored today, part of the hosts here. We are, I work for Drug Free America Foundation, which is a drug prevention and policy organization committed to developing strategies and educational programs that prevent drug use and promote sustained recovery. Our vision is a world where all people live free of the burden of drug abuse. And my particular role at Drug Free America Foundation, I am the program manager for NDWA, the National Drug Free Workplace Alliance, and that's who we're working with today. We're the workplace division. We want to be, our plan is to be a national leader in the drug-free workplace industry by directly assisting employers and stakeholders, a lot of the people joining us today, providing these drug-free workplace program resources and assistance, and supporting a national coalition of those service providers. Please feel free to introduce yourself and your organization in the chat box. We're going to try to answer questions as they come up today. Any that we don't get to, we'll make sure that we get to at the end, but we'll ask that you do put those in the Q&A box, just so they're easier for us to separate out. So everything here today is provided for educational purposes only. This is based on industry and expertise. Presenter opinions may not reflect those of Drug Free America or the National Drug Free Workplace Alliance, but we are here to support our presenters today. With us today, we have Susan Hipp. Susan was selected as the executive director of NETS, the Network of Employers for Traffic Safety, in October 2021, and is responsible for overseeing and leading all aspects of the organization's operations and services, including international growth, conferences, the annual benchmark process, and other road safety programs and initiatives. Susan first joined NETS in 2013 as the marketing and operations manager and has overseen a wide variety of NETS back office operations and membership processes. Prior to joining NETS, Susan worked for the Department of Veterans Affairs Benefits Division in various roles, including Supervisory Veterans Service Representative, Program Analyst, and Management Analyst Human Resource Coordinator. We're super glad to have Susan and NETS with us today. We are also joined by Jackie Terry Hughes. Jackie has significant experience helping companies address fleet safety with a strong focus on risk mitigation. She counsels clients regarding effective fleet safety policies and the enforcement of those policies, and works closely with fleet accident management vendors to identify trends and reduce risk. Jackie also assists companies in managing claims and litigation involving corporate fleets. So you are in excellent hands today as we move forward to talk about the dangers of driving impaired, particularly workplace implications for that. So with that, I'm going to turn things over to Susan.
Great. Let me
Yeah.
take just a second to get my screen up here. Okay, there we go. Thanks so much, Heather. I really appreciate the opportunity to be here today and to share some information. As everybody on this call, we're all working together, to make sure that people are not under the influence. And in particular, NET's goal, of course, relates to driving and driving safety from employers. So I want to share a little bit of information first about NETs and who we are. And just to thank our board members in particular. So we're the network of employers for traffic safety. And these are our board member companies and government liaisons who really support the work that we're doing and really have strong fleet safety policies and programs in place to ensure that their drivers are driving safely. And so we couldn't do what we do without their support. So I just want to take a second to thank all of them. Just to give a little background information, since I would imagine a lot of you are not necessarily familiar with NETs. And again, as Heather pointed out too, please do feel free to break in with questions at any time. We're happy to stop and just make this kind of a conversation today. And really just, it's about sharing information here. So just jump in anytime if you do have questions as we go along. But so NETs it's a member-led organization. We have around 130 member companies, and they're all from different sectors. Healthcare, the pharmaceutical group. We've got a large group of pharmaceutical companies, oil and gas, utility, construction, agriculture, you name it. And it's a group of companies that come together to network, as our name says, to share best practices and learn from each other about ways that they can make their fleet safety programs stronger. And our mission really is to advance road safety with all of our members, not just with their employees who are driving, but also the families and the family members in the communities where they live and work. Because it's important, really, it's not just about driving on the job, but it's about driving all the time, both on and off the job. And so our members are truly invested in road safety and fleet safety to ensure that everybody comes home at the end of the day. It's really what it's all about. So I wanted to share today, in particular, the resources that we have available and talk about why does it matter? I think all of you on this call obviously are invested in preventing drug use and ensuring that people are not impaired, but we again are focused on the safe driving aspect of this. So why does it matter? Well, about 85% of employees in the United States drive to work. That is a large number of people that we can have an impact on. So employers, if they have strong policies in place and talk about safe driving and train their employees and share things that they should or shouldn't do, if those things are taking place in the workplace, that is likely to carry over to the off the job. Your employees are driving to the soccer games on the weekend, right? They're driving to go to baseball games in the summer, going out to dinner. There's, most of us drive at some point within our day, and it is likely the most dangerous thing we're doing in a day. And so we can have a really big impact on safe driving through employers. And so that's what our network does, is really brings forward that information to the employees, and we can have a big impact on the communities because it's such a large percentage of people that drive. So in one study, 54% of those who were seriously injured in a crash tested positive for alcohol and or drugs, sometimes both. As we know, those two can go hand in hand pretty often. And so it's a very, again, driving is one of the most dangerous things we do, but you add those drugs and alcohol to the mix and it can get very serious very quickly. And so a lot of crashes do involve, unfortunately, impairment. In another study that was done back in 2020, they surveyed a bunch of drivers to find out who had driven under the influence. And then based on those responses, they estimated that about 18.5 million drivers had driven under the influence of alcohol within the past year. And we've heard this message for years, right? Don't drink and drive. And that message is out there, and we all know that we shouldn't be drinking and driving, but people still do it. And now marijuana, of course, has become one of the more prevalent influencers of impaired driving. And, so many people do not realize that that marijuana can influence their driving capabilities, and that is impairing. And while states have different laws in terms of marijuana usage, it's very difficult still to detect that and enforce it for drivers. And there is no state that allows you to drive while you're impaired. So even though people think, oh, hey, we're allowed to use marijuana now and it's legal in our state and it's not a problem to use it, that might be true, but you are not allowed to use it and drive while you're impaired. And so there definitely needs to be better ways to enforce that and to ensure that people are not driving under the influence. But as this shows, 11.7 million people in the last year drove under the influence of marijuana, and then another 2.4% or 2.4 million with using other illicit drugs besides marijuana. So that's a lot of people on our roads at any given time that could be driving while they're impaired, which is a serious problem. I remember recently I was actually sitting in a parking lot. I was texting somebody sitting there before I drove off, and I could smell marijuana. And I looked around, and there was a van in front of me. It was so full of smoke from marijuana. I could smell it in my parking spot, which was several parking spots away. And then the person drove off, and they were leaving the parking lot right in front of me. So they'd been sitting there smoking so much marijuana, their car was filled with it. And then they're getting on the road and driving with the rest of us. And just again, serious problem that people often don't think about. So they think it's okay to do, and it's really not. So that's why it matters.
Hey, Susan, we got a
So
couple questions
yeah,
popped up, so I'll ask them, and if you can address them, great. If not, that's all. It's all right too. And Jackie, of course, you're welcome to pop in.
go for it.
Um, I know one question has to deal with impairment. Of course, that is always a tricky question. But Nicole asked, since marijuana stays in your system so long, what's constituting impairment for those particular statistics you're using?
I do not know the answer to that. So unfortunately, I pulled this out of the survey, and I think that again, as I mentioned, there's a lot of gray area here in terms of legalities in the state. And Jackie may have a better answer for this from the legal perspective, because I think for one, it's very difficult to, you can pull a driver over, right, and check for alcohol impairment and do a breathalyzer, and you know right away what's their blood alcohol level, right? We don't have a lot of that technology yet for checking on the impairment for marijuana. And so law enforcement, we kind of put the cart before the horse, in my opinion, because we said, hey, yeah, marijuana is legal. It's great. Go take it. But law enforcement still does not have the tools in most states to check for impairment, nor do they have criteria and laws in terms of what constitutes impairment. So to your point there, it does stay in your system a long time. So, if somebody smoked something the night before and then the next morning they're getting up and driving to work, you know, are they still too impaired to drive? I honestly don't know the answer to that. Jackie, I don't know if you've got a little more information in terms of the legalities for what constitutes impairment.
So I was just going to say I've seen numbers like this, Susan. I don't know if these were the exact numbers, and I think the question was asked, of almost polling, like, have you ever driven under the influence of alcohol, marijuana? So this number of 11.7 is million are those that have self-identified as having operated a car while under the influence of marijuana. So their own definition of under the influence, though honestly, it's quite fair that I think so much goes into how long that marijuana is staying into your system, not the least of which is the size you are and how your body metabolizes the marijuana. So it's a challenge in terms of the impairment piece, but I can concur with you, Susan. I know that various technologies are being sort of worked on, and I think they're getting close in terms of being able to assess impairment sort of in real time from the road, like we do these alcohol testing sort of in real time. There is sort of a marijuana testing and screening that is sort of in process. I don't think it has been rolled out, sort of officially, but I've been reading that we are getting close. Sort of a marijuana screening tool for law enforcement personnel.
Thanks for that, Jackie. Sorry, yeah, I don't know that we necessarily answered the question because there's so much gray area for that still. Unfortunately, it's been really difficult, I think, for law enforcement to determine that. But hopefully we'll have the technology and capability to test for that and to make sure that can be enforced because yeah, it does. It stays in your system for a while and it's not as easy to test for as it is for alcohol, unfortunately. So
For sure. I appreciate those
yeah,
statements. And of course,
yeah,
obviously, if, self-identifying is not a perfect science. But of course, if people are saying, yes, I did drive under the influence of fill in the blank here, there's probably a pretty good idea that they knew something was not quite right and that they may have been impaired. So they may be overstating, well, I wasn't impaired when I was. There just isn't perfect science for that yet. But like Jackie said, there are some fantastic technologies that are up and coming right now that'll hopefully make this an easier question to deal with. Um,
yeah,
so since I've got another question, but I think it'll be a great one for
sure.
the end. So please continue.
Okay, sounds great. Thanks, Heather. So, what can employers do about this? And so, I wanted to share resources today that NETS has available. There's so many resources out there, but we specifically have resources for driving, drug impaired driving. And so, if you go to our website, which is trafficsafety.org, we have a resources tab on there. We have some resources available just for members, but everything I'm going to talk about today is free and available to anybody. And so you can go on there and find all of these at no charge without being a member. So the first one we have is a drug impaired driving campaign. It is a standalone website. So if you go to the resources tab, you can link directly to the website that we have for the drug impaired driving campaign. So one of the first things you'll find on there, and this is also on our resource tab, is our cost of crashes, cost of motor vehicle crashes to employers report and calculator. So this is the cost justification that you can share with leadership if you have a fleet safety program, if you're talking to employers who have drivers, fleet drivers. This is the return on investment to share with leadership to say, this is why we need to put a program in place. This is why we need policies. This is why we need testing and the capability to, make sure that our drivers are not driving impaired. This report shows the costs associated with different types of behavior. It does not, unfortunately, have drug impaired driving, but it does have alcohol use in here. And you can use the calculator to determine your organization's cost of crashes based on a variety of factors. And if you're having crashes, I guarantee that is going to cost, way more than it would if you had implemented programs and put policies in place. Because if you have a crash, Jackie's going to touch on this later, but the liability and the legal side of that. If your employer causes a crash because he or she was impaired while they're driving, that is going to cost you way more than if you had put something in place to prevent that person driving in the first place, because you might have vehicle damage, hopefully not a fatality, but possibly injuries, time off of work for that employee if they get injured. There are so many things associated with the cost of a crash. So the more crashes you can prevent, the better. And so this calculator helps justify to leadership why you need to have these things in place in your organization. So on the website, there are several sections here related to the dangers of impaired driving, the prevalence, laws, the detection, the workplace prevention, and then there are several fact sheets that are available that you can share with employees to talk about some of the statistics and some of the information about impaired driving. So the first section, the dangers here, this is going to talk about what impairment looks like and what it's like if you're multi-drug use, for example. A lot of people do not realize they should not be combining medications. Some people don't even think about the fact that over-the-counter prescriptions can have an impact on their driving. It might cause them to be fatigued. There's all sorts of side effects on certain drugs, and so there are times where people just don't realize how much of an impact that's going to be on their driving. Each of these sections also has what employers can do. And so you can also go in there and look at some of the information and fact sheets and things in there talking about how you can address this with your employees. The second section is the prevalence of drug impaired driving and talking about how often drivers test positive and how many injuries and fatalities are happening because of this, and really gives a good picture of what's going on out there, and then why that it's so prevalent, especially in the U.S. with same things going on. Marijuana use, like we've talked about, has gone way up because it's been legalized in so many states, and so there's really a lot of drug use out there and impaired driving that people aren't thinking about. So there's some information and statistics in this section on that. And then, of course, the laws, as we mentioned, every state has different laws. And, again, it's not legal to drive impaired at all, but there are different laws in terms of, the employment laws and the recreational use and who can or can't use it, where it can be sold, that sort of thing. And again, Jackie will touch on a lot of this in her presentation on the legal side of it. And then detection. How do you find out and detect if your employees have been using this? Some of the technology that's available out there, things about the admissibility in court, for example, and what you can or cannot do with your employees in terms of detection, and making sure that they're not driving impaired, and making sure that you have policies in place to prevent this. And so there's a section on that in there. And then the prevention, because that's the goal, right, is to prevent workplace drug use and impairment. And it's not just within the workplace, but it's also while driving as well. And so educating employees, having drug-free workplace policies, and then the screening and testing. And those are some of the resources that you can look at in order to put some things in place in your workplace. And then finally, there are fact sheets in there, and these can be used. All of the information that we have in there, by the way, can be modified and used with your own logo, your organization's name on it, as long as it's still attributed to NETS and that you give credit to NETS for the original content. We are okay with you taking these and modifying them and using them as you'd like. So a lot of information and facts on here. You can kind of pick and choose and take these things out. And, some places have stand-up meetings where you're sharing information, once a week, everybody gets together, or maybe you have emails that you send out to everyone with information and sharing things. So any of these facts can be pulled out and used in that way, or you could share the entire sheet. So just lots of ways that you can use these tools to share information with your employees. Other resources that we have, again, going back to that resource tab on our website, we also have a link to Driven to Wellness website. It's another standalone website talking about health and wellness related to driving. Because a lot of people don't think about this, but the stress, nutrition, if you're exercising, is your vehicle healthy and in good shape? So there's a lot of areas around health and wellness that can affect safe driving. And so we put together this website to talk about some of those things, but there is an impaired driving tab on this website. And so some of the information is the same as it is on the other website, but there are some different things here too, and some additional fact sheets that you can use, and more information on what employers can do. So this is another source of information for you regarding impaired driving and how you can share this with your employees. And then again, back to our resource page, we for some time had a campaign called Drive Safely Work Week. Some of you may have heard about this, but for years we did this campaign. It was a week-long campaign targeted at a specific topic every year. And since then, we've kind of put together smaller toolkits that can be used at any time. It's not a week's worth of materials anymore. They're just small toolkits on a particular topic. But we've got an archive on our website there with all of these campaigns available that you can take a look at. And so if you go to the resources and find this archive link, it will then take you to all of the topics. And one of the topics in there is impaired driving. And once you get into that topic, then you'll see there's a PowerPoint presentation, there's some fact sheets in there, some posters, some social media, things you can share through email. It gives you kind of a schedule on how you could run this campaign. So again, this can be done anytime. It's not dated. So if you have employees who are driving, these are some great resources that you can use to share with them about reasons why they shouldn't drive impaired, planning ahead, making sure that they understand it's both on and off the job, that it's important to make sure they're doing these things. And so all of these are in there linked up, just to give you an idea of some of the materials here. Some of these are the posters, or you can use these in email just as reminders. It's not just alcohol, but it's drugs as well. And so you want to make sure that you are sober when you're driving. And so just really great reminders any time of the year to put a campaign together to share this with your employees. So with that, just again, our goal, it's all the same. We want to advance road safety, reduce the risk, save lives, and make sure that everybody's driving safe and not driving impaired. So Heather, I think you had mentioned there was another question in there.
There is. I think it's a great question that it kind of encapsulates a lot of what we do. So Philip asks, why are we not recommending zero tolerance for alcohol and drug use like many other countries do? I know one response is that we do recognize that there are people with substance use disorders who are looking for recovery or currently in recovery, and we recognize that those people, deserve these second chance agreements and things like this. So I know that's one thing that we would say. But if there's any other comments on, just kind of the reality of that.
I think from an employer perspective, a lot of our members, probably every single one of our members, has a zero tolerance policy in place. There's absolutely no impairment that is acceptable when you're driving for that company. I would guess that all 130 of our companies have that in place. But for the general public, that's a great question. Why isn't it? Why do we allow any type of impairment whatsoever? So, um, yeah, I agree. I mean, it's really, I think it's difficult to pass laws here. A lot of people fight against, don't tell me what to do. I'm going to do what I want to do. The seatbelt, for example, think about back in the days before a seatbelt was created. Everybody laughed at it and said, That's horrible. I'm not going to do that. I'm not going to wear that." Volvo, I think, was the first one to create the 3-point harness. And they shared that and did not make it proprietary just to them because they realized what a life-saving measure that was. And they put it out there for everybody. They didn't care which car companies took that and started using it. And so now look, every single vehicle has 3-point harness seatbelts in there. And it took a long time for people to switch over and realize that, yeah, okay, this really does help and keeps us safe. But we're still not at 100%, regardless of that. I mean, NHTSA has all the data on that in terms of the percentages of each state and how many users are actually using seatbelts and buckling up. So we're still not there at 100% all these years later. And so I think it's my personal opinion is it's difficult to get everybody to change their behavior and to get on board and to realize that this is about being safe and saving lives. And it's going to take a long time to switch over to that, unfortunately.
Yeah, I couldn't have said it better myself. I agree. And part of what we're trying to do today is to educate more and more people
Yeah.
to these risks and make sure that that message gets out there so people do know, so they can make the smart choices for them. Thank you so much, Susan, for all of that. You've shared a lot of fantastic resources. I did drop that website in the chat. It will also be shared along with this presentation and the recording when we send that out. So please, everyone, take a look at that and use the resources that we provide. All right. Well, now we're going to turn things over to Jackie. Jackie, whenever you're ready.
All right. Thank you, Heather. And thanks, Susan, for that. And I just want to say I am a member of this NETS organization, and there really is an astounding amount of data on that website that is a free resource to folks to use to help sort of construct certain pieces of your sort of safety campaigns. It really is worth checking out. And it's an organization that's actually worth checking out because they're doing a lot of good, honest work, I think, in this fleet safety space. And the collaboration with the other members is really top notch. So I sort of can't say enough about NETS in terms of, what I get out of it. I work for, two of my significant clients are a very large international pharmaceutical company and a large UK-based consumer health company. And I sort of consult with them in their fleet safety space and sort of partner pretty closely with the fleet safety teams to make sure that all of our members, all of our fleet drivers, all of their spouses that are allowed to use our cars as well, assuming they're authorized, are driving, frankly, as safely as possible. So I really appreciate Heather sort of coming to us, sort of asking us to talk about, ways you can keep your drivers safe and ways you can mitigate against that sort of drug impairment, because frankly, it's something that we are constantly trying to keep our eye on. And our goal, like everybody's goal on this call, is, I want all of our employees to get home safe every single night. And I want, our employees never to cause any harm or injury to any third parties out there. And I know that's what everybody wants as well. So just jumping in, Heather, a quick overview of what we're going to address today. And again, this is a really large topic. So I was trying to take and just piecemeal a couple of high level items. And you can flip down, Heather, if you want to go to that overview slide on slide 2. Is just an importance of internal policies. And again, I think my approach for the conversation today is how you can aid your organization or company to keep their drivers sort of safe, and some tips that you can use. And then we're going to talk a little bit about, what the company may be doing to enforce those policies. And then finally, I pulled out a couple of recent case examples involving impaired driving, because I think it is so demonstrative to sort of show what courts are doing out there and what they're looking like. Companies can think they're doing a lot in the space to keep their employees safe from drug and alcohol impairment, but there's a lot that goes into it, and it's not necessarily sort of a one-size-fits-all situation. So just going down to the next slide, Heather, if you can. What can you do as an organization to mitigate against your drug-impaired driving? And this also includes alcohol-impaired driving. And from my perspective, it starts before anybody walks in the door. I am not hiring anyone without some significant sort of pre-screening of them. At the organizations that I work for, there is mandatory pre-hiring drug testing, as well as mandatory sort of motor vehicle record screening. And so what that means is the organizations, again, that I work for has set up some internal criteria. So if you come to me, I'm going to make sure you do a full drug test. I'm doing a full background and criminal check on you as well. But then I'm looking at your motor vehicle record. And if I see you're sort of a road runner out there, and that you get multiple speeding tickets over the past 2 or 3 years, and your MVR record is really robust, and if if any one of us has pulled our MVR records, and I'm seeing multiple accidents or multiple tickets or multiple risky behavior, then we are not going to hire you. And I work for organizations, I'm really proud to say, that have had some outstanding candidates, like top salespeople. And this is who are in our vehicles. We have salespeople across North America that are selling our pharmaceutical products. They're logging hundreds of thousands, thousands and thousands of miles sort of over a given year. So it is critical that they and we do everything we can to keep them safe. But some of these folks are absolute superstars. So if you come in as a superstar, but your record is still replete with this like pretty dangerous driving history, then it's a hard no. We literally have these conversations with our business stakeholders. And as this sort of part of the fleet safety team, we say, no, we're not going to authorize them to drive. And if they are not authorized by fleet safety to drive, they are then not able to do an essential part of their job, because we don't allow our people to drive their private vehicles. So it's sort of the first guardrail we put up to try to make sure that we're hiring the right types of folks, and as well that like our employees understand how seriously we do take this. So it starts from the top of our organization with respect to that leadership, and being able to, sit across from a vice president of sales and say, these are the reasons why we think this person is a risk and that you should revoke or not hire that person, in the first instance. So make sure we know who you're getting before you walk through the door. And then number 2, once they're in the door, how do we keep them safe? Well, obviously a robust training program, obviously robust and consistent policies. And by this, I mean, depending on the size of your organization, I have been privy to organizations that have a code of conduct and an internal drug and alcohol policy that sort of sits over here. And it's just a generic policy that applies to all employees across the board. And then there's the fleet group, and maybe fleet sits under environmental health and safety. Maybe it sits under HR. Maybe it's its own organization, fleet safety, depending on how large your fleet group is. And then there's another drug and alcohol policy that doesn't necessarily match. And then speaking from experience, you want to make sure that the language is identical, because if employees can wiggle out of something or try to wiggle out of something, if they are caught in a situation, they absolutely will. So as you're drafting policies, as you're looking at your policies, make sure there is one consistent drug and alcohol policy that is enforced across the board, and that there is no sort of loopholes that one can find in that policy that would allow somebody to do something that is not your intention, especially in the drug and alcohol space. And then I want to talk about, what you can do with respect to, it's never enough to look at them before they get in, train them once, have a nice policy that's consistent, and then just say, Godspeed, go. Try not to get into any accidents. That's never enough if you are working with fleet drivers and people that have to drive every day for a living. It is really critical that you keep sort of touching those individuals so they understand the importance and not lose track of, keeping safety at the forefront each and every time, each and every day, each and every time they walk out their door. In our organizations, or the organizations that I work for, we also consistently train. And then in certain circumstances, we will do randomized drug testing. And a good example of that is for one client, we have shuttle bus drivers. So we have some massive sites that have multiple buildings. Sometimes we have 2 manufacturing facilities that are maybe 20 miles away. And then employees will have to spend time at both. So we have an organization that shuttles our passengers back and forth. Pretty important position, that driver of that shuttle bus, because number one, you're up and down our property all the time. Number two, you are transporting our biggest assets, which are employees. And number three, you're in a big bus with a bunch of people that you could hurt some third parties, right? So what do we do with those folks that, seems particularly, more hazardous? So we do randomized drug testing for those folks. And those folks that, take those positions on sort of are told, we're going to randomly drug test you. And of course, where we have commercial drivers, they too are randomly drug tested.
Jackie, if I could jump in, I'm sorry to interrupt you, but I wanted
Yeah.
to share recently I was out of the country on a trip, and we were on a shuttle bus going on a tour, and we stopped for lunch, and the shuttle bus driver had a breathalyzer in the bus and had to blow into it before we could take off again. And the tour guide said anytime that we take a break, the driver has to do this breathalyzer to ensure that he hasn't been drinking, which I thought was fantastic.
That is
And, why
fantastic.
aren't we doing that? It's, the question earlier is why don't we have zero tolerance here in the US? Why don't we have systems like that in place to
Yeah,
ensure, we do it for companies, but, it's fantastic that this tour bus driver had to do that, I thought. So,
absolutely. Absolutely. So I think, members of our audience will sort of, I think, respect, like, this is sort of team, let's keep it to that zero tolerance, and let's do what we can within reason to ensure that our people and that our organizations are doing what they can to make sure we're keeping sort of people safe. But I love that story, Susan. So just sort of jumping back a bit with respect to the consistency of the policies and then the enforcement of those policies. So random drug testing is an absolute great idea. Drug and alcohol testing assumptions after an accident is an excellent idea. And this brings me back to a policy piece. For the organizations that I work for, if you are an employee that was involved in an accident in our vehicle, you cannot refuse a drug and alcohol test sort of by a police officer. You can't say no to a breathalyzer. That's considered sort of a policy violation that we take very seriously, and assume the reason that you're denying doing that is because that there is something to find. And that decision in and of itself has other ramifications, attached to it. So like, as you're thinking about those policies, like, think about them all the way through. So your employee gets pulled over for potential impaired driving, and then the employee says, no, I just had that proverbial 1 beer or 1 glass of wine, I'm fine. But when a police officer says, fine, let me do a blood alcohol test on you, and they refuse it, that then brings up a host of bells and whistles, right? So Just something else to think about as you're drafting your policy through. We like to be as clear as possible with our drivers, unfortunately, because we've seen a lot of different scenarios play out. We've seen our drivers refuse those tests. We've seen our drivers consent to those tests. And unfortunately, we've had drivers that have absolutely driven under the influence and are no longer employed by our organization. Again, just something to think about as we talk about with respect to these policies. And then also after accident, and after one is found to have perhaps been impaired driving, what are the ramifications that your organization wants to take? And you need to have these hard conversations. I will say for the organizations that I work with, we absolutely spend a lot of time in the details of each and every one of these matters. And by that, I mean, most often, if someone has lost their license as a result of a drug or alcohol citation, they will lose their ability to work for us because they're no longer able to drive for X amount of time. And usually those things last for 6 or 9 months. You don't just, you don't get your license with a hand slap in most instances and then turn around and get your license reinstated 5 or 6 days later. So there are organizations that have a hard, even if you are cited for a DUI, you will lose your position. Other organizations say you have to be convicted of that DUI in order to lose your position. But I mean, what we're looking for is a number of things. Again, this really depends on the company's culture and where their priorities are. But there's sort of, if there is no remorse out of an employee that's like, I only had a beer, I really wasn't drinking, I wasn't then there is going to be, this employee will lose their job, sort of full stop. Sometimes these events have led us to understand our employee has a significant problem. There is absolutely something happening. They'll be referred to an EAP. They'll probably be put on leave. They may or may not lose their employment. Again, it's very much contingent on sort of that company culture and approach towards what's happening here. Maybe they do have some disorder that, needs to be addressed. Again, I think the first and foremost in our mind is, well, if they do have this disorder, how can we mindfully even give them a vehicle right now, knowing what we know, and they, get put on some sort of leave, and we see what happens, based on what happens after their treatment. Again, there's a lot of potential situations, but I think having some honest conversations with the company that even if you are the most well thought of employee here, if this happens, where is your red line? Where is your hard line? Where is the line that somebody cannot cross? And you as a company have to continually articulate what those lines are. Is it zero tolerance? Is it zero impairment when operating, machinery and the numerous manufacturing sites we have, as well as manufacturing, or as well as, zero tolerance with respect to operating a vehicle? The answer is yes and yes. So if someone's going to ask my guidance, I'm going to come with the most conservative approach that keeps as many people safe as possible, because, and unfortunately, I've seen the ramifications of those decisions on the other side. So I just sort of throw that out for consideration. And then how does the legalization of marijuana sort of change this environment? How does it change anything that I just spoke about? And the answer is it doesn't. From my perspective, marijuana, if it's legal in the state, it's like alcohol being legal in the state. The companies that I work for still have a zero tolerance, zero impairment permitted for any time you're operating this heavy machinery. Medical marijuana, personal marijuana, recreational use, it's irregardless, zero drug and alcohol in your system when you are in our place, when you're in our business, when you're doing our business, sort of full stop. So I think there's a lot of chatter out there, a lot of noise about what companies can and cannot do to accommodate, especially the medical marijuana provision. And I was sharing with Heather and Susan yesterday, that feels like a legal rabbit hole to me, and very much sort of a labor and employment issue and labor and employment legal issue that is not something that's in my bandwidth. But I do want to say, when we're talking about the basics of keeping your employees safe and safe driving, it should still be a hard line, zero impairment, full stop. So if we could go to the next slide, Heather, I just want to share out a couple of examples, relatively recent examples, unless we want to stop. Do we want to stop for a question, Heather?
We just had a little follow-up question, just about the, sort of the breathalyzer type thing.
Yeah.
We were asked, like, do we know, are there breathalyzer companies and impairment testing type companies that are testing these levels, that account for things like DNA? Because of course someone else could use the whatever device that might be. I know there's certainly lots of technology out there on the horizon, but definitely I think all of us recognize that the more steps, the more challenges, the more hoops you have to jump through to circumvent the rules, the more likely that we're going to get people following the rules. So I think each step in that case is a good one. They may not all be perfect, but that's okay. So
I
it's just
think
kind
I
of
saw that. Sorry, Heather. I was gonna say I saw that question in there, and two devices that I know of. DADS, if you've heard of that, DADSS in particular. I know I believe they're actually working with NHTSA on some detection technology. One is the breath of the driver. The other is a fingerprint system. So not necessarily DNA, but they are working on to ensure that it's not somebody else, pushing the button to start the car, that it's sensing the fingertip and it detects the alcohol under the skin, basically. But I think they are working on or have already created a way to determine if it truly is the driver versus somebody else. So that's something you can check out. DSS, I think, is the system. Another one that I've heard is it's called Sober Safe, SOBR Safe. And they have a wearable device now, as well as a device you can put in a facility, like as employees are either entering your organization, or you can put it in a vehicle. But the wearable device and the other device as well, it's going to scan a fingerprint and or sense it under your skin if you're wearing it on your wrist. And they do have a way to set up their system so that it's only for that user. And so this is a great device, for example, for truck drivers who maybe aren't returning to the place of employment every single day. It's sending information back to the organization if that driver stops and then goes and drinks and then shows up as having something, like if they've got some impairment going on. So I know those are two devices that are out there, and I'm sure there's plenty more, but that are now using that skin detection or fingerprint detection for that.
That's fantastic. There's so much new technology that's being created. Try to keep an eye on all of it. So it's worth keeping an eye on for that sort of thing, to try to keep as many people safe as possible. All right, Jackie, I'll hand it back to you.
All right, thank you. And apologies for the size of this font. I am going to share these decks out. So I'm just going to sort of talk through, like I said, a couple of these cases. So this is from a 2023 case. And again, sort of from the aspect of how are we protecting our organizations? And what can we do? So we have an injury caused by a truck driver. Truck driver and his employer was sued, asserting the driver was driving while intoxicated, multiple vehicle accident. Plaintiffs here saw compensatory and exemplary damages. That's basically punitive damages, exemplary damages. Here, we know the driver had a history of dismissal from employment for minor incidents. He also had a history of anxiety and depression, which he admitted to and admitted to taking Xanax for. On the day of the accident, the truck driver was distracted. He leaned over to his right because he heard something. When he returned, cars were right up on him and he caused this massive collision and massive injuries. Some red flags here. He failed the field sobriety test and he refused to voluntarily submit to a blood test. And then the police officer issued a warrant and he had to. And no surprise, the test revealed positive for Xanax, Paxil, benzoyl and cocaine. So district court awarded about $12.5 million against the driver and the employer. And then there was a little legal nuance here because the court did not issue the punitive damages against the company. And why that matters from a practical standpoint for this family is, as you can imagine, I don't know if anybody else on this call is, but I don't have $10 million handy that if there was a judgment against me, I could write this check for. So here, it was really important to the injured parties that they go after the employer so they can access that money. But the court did not award that $10 million in punitive damages against the employer. So this went up on appeal. And then the standard of judgment here was that if the evidence shows that the employer contributed or might have prevented the employee from driving while intoxicated, then the employer should have some responsibility. So just going on to the next page, if I can, Heather. And then I just wanted to sort of share out the evidence that was presented in this case. So here, what did the employer do? And honestly, it sounds pretty good. They ran reports to investigate the driving record. They looked at his previous employment history, his criminal history, whether he had any previous drug and alcohol history. So I'm checking all the box right now. Pre-employment drug testing, great. What else did the company do? They did a background check. Looks like they did a criminal check as well. They contacted 3 past employers. They searched records, and they obtained negative drug results from previous employers. That sounds great. What else happened here? Well, going down, it looks like there were some pending charges against this driver for controlled substances, that the case was dismissed, but that did not render him unfit to work for this company. There were 2 previous terminations that could be, determined to be a potential red flag. There were 2 minor traffic incidents in 2 months and 1 failure to report an accident. That's a big deal. At his medical exam, the driver didn't disclose his longstanding treatment for depression or anxiety or what his prescription drugs were. And then here's a couple of biggies that the court took into play. The driver didn't complete his required computer training because he didn't have a computer. Now, you may be saying, well, Jackie, that's not my problem. This poor truck driver didn't have a computer. Well, it is the employer's problem, because if you're going to issue this training and not give your employee the means to take that training, this is going to come back on you at some point in time. And extremely importantly, this driver didn't turn in over 140 daily driving logs. So it's an interesting case, because while it looks like these guys were doing everything really well in terms of trying to keep their employee or their drivers sort of safe and like keep a handle on them, the reality is, they dropped the ball in a couple of different places. And the court found, like, what, had you done all of these things right, perhaps we would reconsider issuing this, this damage award against you. But we do think, employer, you could have prevented what occurred, and therefore we're going to find you responsible for those punitive damages. So again, just sort of a demonstrative sort of learning from the courts. Heather, jumping down to the next slide if we can. This was a sort of different sort of case, but I wanted another accident by a mobile mechanic who ran his Ford F1 or F450 into plaintiff's vehicle while he was under the influence of heroin, which was laced with fentanyl and cocaine. He killed the driver. He significantly injured the driver's sister. Sunbelt was the mechanic's employer and the company that provided drug testing services to the employee. The employer was sued, and the third-party company that provided the drug testing services was also sued in this case. So Sunbelt voluntarily agreed that all of its employers must engage in this drug testing, even though they were under no formal obligation to do so. That did not extinguish Sunbelt's liability here. And in fact, Sunbelt resolved this case as against the injured parties. Going on to the next slide, please. What was interesting in this case, Sunbelt also had pre-employment drug testing in place, but it was non-monitored. And then this particular driver had another accident, and Sunbelt sent him to get, even though it was a minor one, also sent him to get drug tested. And this employee was quite clever and took a lot of pains and intentionality to use synthetic urine on both occasions, not only to get hired, but also to defeat this sort of second drug test. So the injured parties here said, hey, Sunbelt, you resolve the case against me, that's fine. But third-party testing company, you bear some responsibility too. Because why did you allow this synthetic urine in? They had a whole debate about, sight, smells, what synthetic urine looks like versus, human real-time urine. And the bottom line is the court found, no, there's a little too much gap between the independent third-party drug testing company and the injured plaintiffs here. So they did not hold them responsible here. But things to think about: the non-monitored drug test as a company. Is that really a good idea? If you're going to go through the pains of having drug testing at your organization, maybe it needs to be monitored. Maybe it needs to be real time. Don't let employees have hours before they get called in to, do their drug test. Make sure you're doing it as close to the call for the drug test as possible, and make sure that that drug test is monitored. Unfortunately, I think, my little learning from this, I did not know much about synthetic urine, but it's a thing. It's a thing that's so simple to get your hands on. It's, like the only purpose of synthetic urine is to defraud drug tests, right? So I think companies know this, and the fact that it's so readily available now out there, like, puts companies on notice that don't allow unmonitored drug tests. I mean, that would be my guidance. Going on to the next test, and I want to be, real conscious of the time as well. So this is a 2020 case where very significant damages. We had a semi-tractor who collided with the drivers in this case. Again, the driver and the employer were injured. There was a dash cam that was pulled in the truck that showed, the driver taking his hands off the wheel. After the collision, of course, the employer required a drug test of its driver. The driver was terminated even before the results were back, because apparently this driver was already on probation for a prior incident while operating another vehicle. Notwithstanding, the drug test that was done came back for marijuana, amphetamines, and methamphetamine metabolites. The allegations were as against the employer, and you could go down to the next slide, Heather. And just a little overview of what could the company have done differently, and what can we learn. So the court went through, because a smart plaintiffs counsel are going to bring an organization through all of these, and they're going to look for the misses, like where did fleet safety, where did HR, where did the EHS and safety teams sort of miss something. So here, there were multiple missed opportunities determined, starting with the driver's employment and his fitness as a driver. They noted that he was untruthful on his application, having reported only one ticket. However, his MVA report, once reviewed, showed a far different story. The employer said, it wasn't our fault. We engaged this third party to pull the MVR for us. It wasn't our fault that we didn't sort of thoroughly review it. And the court said, it is your fault. It's your obligation to make sure your contractors are doing their job and properly screening your employees or pre-hires. And then the company, knowingly, one of the allegations, put an unsafe driver behind the wheel. The driver had 4 prior incidents, where 3 of which he was suspended for, and 1 he was on probation. So this is a driver that was a clear high risk, yet the company sort of took it upon itself to say, yep, we'll still put that person behind the wheel. Remarkably, the driver never received any formal training. He was only given some paperwork and told to sign it stating he was given the training. Again, really remarkable. And then the driver admitted that he was using drugs on each of the 3 days prior to this accident. So of course, that begs the question, where was the company's, randomized drug testing? What was the drug, standardized process? What was their drug and alcohol process? So lots of things that sort of went against the company in here. And again, some, terrible outcomes leading to some significant injuries. Because this, for me, yes, the amount of the damages is significant, but what's obviously more significant is there had to be some horrendous injury caused as a result first. And that is where, everyone needs to sort of keep their focus. And then just finally, I'm going to wrap up because I know we have only 3 minutes. Just a high level on marijuana use. Again, the terrain is constantly shifting. but I just want to wrap this up by saying, don't get, especially in the fleet safety space, don't get sidelined by the permissive use of marijuana in any state, and even the medical use of marijuana in any state. I would suggest there be a hard line with respect to impairment and zero alcohol and drug use while you're in our building, while you're operating our machinery, and most certainly while you're operating any of our vehicles. And I think that's where your focus needs to stay, and make sure that you're make sure that that engagement and that focus also is coming from the top, because there's only so much that's going to be able to be accomplished. You need your leadership well on board, for obvious reasons. And that's all I had, Heather.
Fantastic insight. I really appreciate the look into some particular cases, so people can see, well, these are the sorts of issues that other places have dealt with, and maybe we can be proactive in avoiding any of those things happening and keeping people as safe as possible. I'm going to give everyone, a couple more seconds to see if any more questions pop in. But while that's happening, I want to thank you both so much for joining us today. I feel like we've learned a lot. We have a lot more resources to move forward with. A couple of thank yous coming in, which are also fantastic.
That's one last comment here too, if I could. Just first of all, thanks again, Heather, for having us. But definitely proactive versus reactive, and you both you and Jackie touched on that point, and we say that all the time. And that's you have to be proactive in addressing these types of issues before anything bad happens.
Absolutely. Well, thank you all for joining us. I do just want to remind you that the National Drug Free Workplace Alliance, we can help people set up their drug-free workplace policies. Of course, you want to have your company's lawyer take a look at everything, make sure that all of your I's are dotted and T's are crossed, but we are happy to help with that process and with training for reasonable drug and alcohol suspicion, especially for supervisors. So please reach out if any of that can be helpful. And here's all the places that you can reach us. In the next couple of days, we will be sending along the recording, a certificate, as well as this information so you can follow up on anything. And thank you all so much for joining us today. Goodbye.
Thanks, everyone.